Hello, today we are with Marianna Everson, who's a candidate for state representative in Legislative District 19. Thank you for joining us today, Marianna.
Thanks for having me. Appreciate it. Thank you so much. So,
Yes, please go ahead, give us a little information about yourself.
all right. I'm a nurse and a mom here in Grace Harbor County. I have been active in my community as a community organizer and have been serving the people of this district in my work as well. I serve the people of LD19 as a registered nurse in the mental health care industry. I care for people in mental health crisis when they're a danger to themselves, danger to others, or gravely disabled. Help them find their way to recovery, and we also help them find their way into the world with housing and outpatient services and all the stuff. I think that this work has been the calling of my life, but I have come to realize that I need to expand that calling to all the people of LD19 and all the struggles that we all have, because we're worth it. We deserve to have a good life. And so I started lobbying my representatives in our district and a little bit out of the district, and also our congressional representation, and kept getting no, I won't use my political capital on universal health care, is one of the answers that I got. And so I kept looking for someone to run to challenge these people. And we have specifically one Republican that represents us in our district. His name is Jim Walsh, and his ideas are outrageous and divide us up every day. So I kept looking for someone to run against him. Let's get rid of this guy. This guy is hurting us, and nobody would do it. Oh, I can't afford it, or I have kids in college, or are you crazy? All those things. And then it just came down to, well, I guess it's going to have to be me. So I decided to run against Jim Walsh.
Excellent. Thank you. Thank you so much for doing that and doing our community a service. We need more people to do those things. We really do. I looked through your website and I noticed that you have a lot of talk about taxation and how it can be more fair for your constituents, the people of LD19. How do you think that we could make taxes more fair for Washingtonians?
Yeah, so Washington has the most regressive tax system in the country, meaning I pay more in taxes to the state of Washington and the city of Montesano than Jeff Bezos does as a percentage of my income, right? And so do you, and so does everybody that works for their wage. Because we have a sales tax as one of our primary ways that we collect taxes in our cities and counties and at the state level. Anytime you buy something that's not food, you're paying a tax. And poor people and working class people like me, we spend all the money that we make. We don't put it in the stock market or offshore or somewhere else for it to be safe from these kinds of taxes. And Jeff, he's a guy, he's like a human dude, and he wears a certain number of pairs of pants, right? How many pairs of pants could he possibly buy to make up for the amount of taxes that I'm paying and the little bit of tiny bit that he's paying as percent? So I believe that we need to find ways to tax people who make more money than they need. It's not right that certain rich people make so much money and pay so little in taxes. And so I think we need to stop funding our state off the backs of the working class and poor and start, it's like an opportunity, right? Like it's this untapped resource that we have in Washington, that there's this mass amount of money that we've never taxed. So we can start taxing it with however you want to tax it, with an income tax, which we'll have to fight for, because it's in our state constitution that we can only have the same amount of income tax for everyone. But we can do that right away. We could say anybody making less than $1 million is exempt from the income tax, and everybody making more than $1 million has to pay the same amount of income tax. So say 1%, 2%, 3% of their income to the state. We could do that right away. Politicians are afraid to do this. Like, they're literally afraid to tax the rich because they think that the rich will leave. Well, I say let them go. If it's that bad that they don't mind paying, that they're gonna have a big problem paying their fair share, we're not gonna, like, take everything they own and make it socialism or something. Everybody gets the same amount. I'm saying they can afford it, they should pay. And there's a lot that would. There's a lot that would be fine with it. They would be willing to give. So let's do it.
Right.
I don't.
They're a part of our community. They have to go out and be on the street and see, the tent communities that are popping up. That's not good for them.
Yeah.
That's not good for their families. It's not good for their employees. And they do the best they can to have as few employees as possible, but they do have employees that they have to pay for the health care, and it costs them. If their employees are stressed and having to live in that society, it's going to cost them as well. I think the falseness that we have in our country right now is the idea of self-made millionaires, self-made billionaires, and now self-made trillionaires. Nobody does anything by themselves. Like, if you use a public road, if you use water at your house, those are things that our society has made, that generations of Americans, put their life's work into creating these things. We didn't just wake up one day and they were manifested. They already existed. That was work that was done by Americans, over decades and centuries. And now they're using those systems to become insanely wealthy and then say, oh, I'm self-made. And it's a lie. That's a lie.
It is a lie.
Self-made in our country. In any country around the world.
That's right.
So on to more like the corporate corruption. What kind of corporate corruption have you seen in your district and then around the state?
Sure. Well, the place I live, I call timber country because we supplied the boards that built the majority of the homes across America after the Great Depression. Had a big housing boom. We started building suburbs and all of that. And those resources came from here, at least mostly. Millions of board feet of trees were cut down and made into homes. So those companies that own those forests, they have a massive tax break. They're Wall Street traded companies like Weyerhaeuser, Simpson, Georgia Pacific, and they get a massive property tax break from the state of Washington. And the deal was so that they could, because they were supplying so many jobs, right? So many people had these good union wage jobs. My dad had one of those. So that was kind of the deal. Like, okay, we'll give you this tax break because of all of these jobs. Well, those jobs are gone. Like, there's a couple of Weyerhaeuser mills in my district still, but they have a minimum of employees, just like, they've automated most of it, right? There's not like hundreds and hundreds of people working there. There's some small sawmills around that are doing okay. They're paying their employees a pretty good wage and benefits, so that's really good. But it's not the massive amount of people that used to have jobs, in this industry. So that's one way that tax loopholes, tax breaks have been exploited so that the state doesn't get the revenue that it needs, but this Wall Street traded company, gets to put it as a line item on their bill, right? They don't have to pay these as much as taxes. Like, I'm a tenant, but my landlord pays his taxes on this property, right? And he gets that money from me, and he pays a certain amount of property tax, and he pays a higher rate than Weyerhaeuser does, or Simpson, or Georgia Pacific, and that's that's just not right. And another way that corporations take advantage of us is my son used to work at Walmart, and I'm sure our audience knows how Walmart works. So they pay the bare minimum. They offer really crappy health insurance, if at all, and then they treat their workers like crap. Like literally, my grandson. Well, okay, this is a personal story, but my grandson was having seizures, and my son needed to have some time off to be with him while he was in the hospital, and Walmart fired him, let him go because he needed that time off. It's just you couldn't, because he couldn't produce, right? He couldn't produce. He wasn't useful to them, so they let him go. And so people at Walmart are on food stamps and live in Section 8 housing, and get Medicaid and all this stuff for their kids because they can't afford to live. And Walmart can afford to pay their workers just like Safeway pays their workers, or Fred Meyer pays their workers. They can be paid the same amount, and that's due to Walmart being such a union buster. They've never allowed it into their companies. So yeah, those are a couple ways.
Yeah, yeah, that is so very true, because now we have corporations that are saying they can't pay people, respectable wages, and I think that's even above what they're calling livable wages, because in our state now we're being told that we're so great because we have a $15 an hour minimum wage, right? Like that's
Right.
the work for 15, and like we're considered to be ahead of the rest of the country. But then I where in our state can you live on $15 an hour?
Nowhere.
And especially in those kinds of jobs where they don't even have set schedules usually. If you're at a minimum wage job, if you're at a $15 an hour job, you're not getting Monday through Friday 9 to 5. You're
Right.
getting the shift that they're handing you, and then if hours are, if profits are down, they're going to reduce those hours.
Right. And you
depending on
don't know what you work from week to week.
right. You're getting a
You
weekly
know?
schedule, right, with an update
Yeah.
based on what
You
they
don't
think
even
you're doing.
know. Yeah. Oh, could you come next 2 weeks from now to a barbecue? Oh, I don't know. I'll find out what my schedule is. Can't. And then how do you pay for childcare with that? Right. So you work at Walmart. Say you're even a dual income family, right? How do you pay for childcare when you have to be at work until 10 p.m. or arrive at 4 in the morning, or how do you even schedule that? It's not even possible.
Yeah,
The only thing that you can do is what I did when I was with my first husband. He worked from 6 to 2, and I worked from 4 to midnight. We never saw each other,
right.
and we just traded off the kids.
For
What
minimum
kind of
wage
family
job.
life is that?
Right, for a minimum wage job, or
Yeah,
a job that doesn't really respect you as a person. You know what I mean?
that's right.
It's you can really see when you look at the situations we're putting people in, why there's so much disappointment in the system right now.
Yeah.
To change topics just a little bit, I've heard that you are involved with Whole Washington. Would you please share your story about Whole Washington and why you're involved?
Sure. Thanks for asking that question that way, because that makes me think of the entire story. So, in I think it was 2017, the county of Grays Harbor was lack for a health insurer for people on the exchange. Right? Nobody wants to cover Grays Harbor County because we have horrible health outcomes. We have the most addicted people. We have the lowest life expectancy. We're poor. We're poor people out here, and not everyone, of course, but it's not easy. So I went looking around as I was working in a group called Democracy Rising that I helped found. It morphed into Our Revolution, Coastal Washington, at some point, but we were Democracy Rising then. And we wanted to explore, well, what else could we do? Like, if we couldn't get somebody to insure people here, what would the alternatives be, and how do we get there to an alternative? So we, of course, being a bunch of Bernie Sanders supporters, we wanted to talk about universal healthcare, single payer, right? So we looked into that, and we found a couple of groups in the state that we previously didn't know about, that were talking about that, which was Healthcare for All Washington and Whole Washington. And representatives from both of those groups agreed to come to our empty mall, where the mall gave us the center stage to set up some microphones and do a community discussion about what is universal healthcare, what is single payer, how can we do healthcare differently. So Georgia Davenport from Whole Washington showed up, and I really liked her, and we got to talking about all kinds of stuff, and I decided to get involved and stay involved. I helped collect over 1,000 signatures for the I-1600 when we were doing the People's Initiative. And then I just stayed in contact as we made it into a bill for the state legislature, which is Senate Bill 5222 right now. And I've been fighting ever since. So my next step for Whole Washington is to get elected to the state legislature in the House and become one of the sponsors of Whole Washington's Health Trust, and get a not-for-profit healthcare system available to the people of Washington that covers everybody, everything. So I was like blown away when I read the bill. You can go to wholewashington.org and read it. It's just right there. The funding study's done. We don't have to wait for waivers from the federal government. We could do this right now. But I was blown away that, like, you think medical, dental, vision, inpatient, outpatient, all the stuff that's covered is like all these health benefits. But then like you keep reading is like acupuncture, ambulance services, prescription drugs. It's all in one thing, and there's no cost at the point of care. So you don't have a copay or a deductible. You just pay, your payroll tax or, into it, and then your kids are covered, you're covered, and you don't pay anything when you go to the dentist. Can you imagine like going to the dentist and not paying $3,000 or whatever it is? That'd be so cool.
It's amazing. And it sounds like it's looking at the holistic side of medicine, that like we don't,
right.
Medicine isn't just for when you're sick, right? Or when you're dying. Like if you actually take care of yourself before
right.
that happens, it's actually a lot less expensive and a lot less taxing on society. It also allows people to be more useful, to be more productive, right? If you
right.
get these things off, you can be a productive individual for far longer, which, I think the problem right now is we look at too many of these things as just the expenditure, just the cost. What's the upfront
right.
cost? Not in like, what's the cost if we don't do this, right?
That's right.
That's what
right.
people are forgetting to ask themselves is, what is this costing us if we don't do it?
Well, it's costing us lives. My patients, I have had patients who died because they didn't want to leave their loved ones bankrupt when they go. I've had patients die because they couldn't get the treatment that they needed. Like, I know that I'm a little bit different than most people. I don't know why, but my heart is in this with my patient, right? It's not like, oh, that's the customer and I'm the worker, There's no wall for me. It's they're now part of my consciousness, my world, and I remember just about everybody that I've ever taken care of. If I see them again, I'm like, I know you. You have the mole on your, But anyway, I care about them, like personally care about them. So I don't want them to die or go bankrupt because they need health care, right? I think that, once I started thinking about that, like it took me a long time to even come to this conclusion, right? I was just like everybody else, like generally voting, kind of just surviving, because until I became a nurse, I was working those dead-end jobs, and I was just trying to survive. So once I started being able to have the moment to think about that, I was like, yeah, people shouldn't die because they can't afford to live. That seems so morally wrong. Why have we accepted that in our society? It's not okay.
So true. Sort of playing off of that, now I know that I've seen like in Washington State early, one of the first survivors, the first of COVID, you know, he had been in the hospital for an extended period of time, and came out with a bill over $1 million that he didn't have to pay because it was, you know, because of the way that they had set up the COVID relief. But you just think about that, like how many people, and he was an older gentleman in his 70s or
Mm-hmm.
whatever. How do you at that age justify that kind of debt for anything, right? So that person is now like an indentured servant to the medical system if he had to pay that money.
Yeah.
And I mean, he was blessed enough to do it with the situation, but how many other people through our system are dealing with that every day, where it's like,
Right.
it's a choice of, do I become, you know, tethered to this debt for the rest of my life just to get this little bit better, right? You know, and
Right.
it
Right.
is a very unproductive, I think, train of thought when you're having to think like that in a system. But going to more to COVID and to schools, what's your opinion on schools opening in the fall with COVID still around? You know, I mean, as it looks now, it's going to be here, and hopefully we get more treatments, but things like vaccines are, you know, at least a year out, you know, most likely, if not longer.
Right. Right. And that's just something. I mean, I'll just say a little bit about that, about the timeline. Like, that's something that we, like the, I don't know who, the state, the media, the federal government, they haven't been upfront with as much, that this is going to last a while. You know, this is going to go on, especially in America now that we're not controlling it like we could have. This is going to go on for a while. This is a year. This is 2 years. There's going to be people who pay for it the rest of their life, and not financially, but like medically. Like people who've had COVID, their bodies are changed, you know, forever. But this is going to go on, and we have to adapt and adjust, just like with anything else. I mean, this is one of the biggest things in the last 100 years that we've had to deal with in this kind of way. So I'll just say my kids aren't going to school in the building this year. I have a senior, a junior, and a kindergartner that they're gonna miss it. They're gonna miss out. It's not any fun. But the cool thing about it for my teenagers is they're so digitally connected to their friends that they see and talk to them every day anyway over their phones or Discord or whatever, you know. But I don't think it's safe to send our kids into the schools the way they are now. So one of the ideas that I've been reading about is decentralizing schools. You know, so Montesano, little town, we have 3 schools. We have the two grade schools and then the junior senior high building, right? And a lot of cities are bigger, and I get it. But if we decentralize our schools, if we put those kids out into other spaces, churches, libraries, empty buildings, you know, the senior center, you know, different places, and have fewer kids together in one space, we could do it safer. And that would only be for things that have to happen at school, you know, like we talked about like things that are hands-on, things that you have to touch the computers or use the lab or, you know, that sort of thing. And then kids can learn in other ways. Kids adapt. They're already digitally proficient, right? Like if I don't know how to use this, I just say, hey, will you show me how to make that work, to my 5-year-old, you know? It's like they inherently know how to use this stuff. So yeah, they can learn distantly. And also I started thinking about, I don't think I read anything about it. I think I just kind of started thinking about it. Like, what would life be like for them if they didn't go to school for 1 year? What would that change for them? Would it hurt them? Would they be dumber? Would they lose things? I mean, they were still smart and wonderful and beautiful and able to learn it, you know, in 9 months or a year or whatever. They'll still be able to pick it back up and run with it and go, even if their learning opportunities aren't the best for 1 year. It won't affect them in the great big scheme of things. So like, if you think of like the pandemic in 1918, 1919, I don't think there were many kids going to school, or maybe there was challenges going to school during World War II. I bet you there was. And prior to there being organized school, kids learned things, you know, and learned how to be good humans. by with their families or close relatives. If you think of it, take the picture out bigger. Our kids are going to be okay, even if they don't go into a building to learn for 1 year. And they really are. They're going to be okay. The problem is families need that as daycare, right? Families need that so that they can afford to go to work. And so that's where the problem lies. Lack of technology, like lack of broadband service, that hurts, kids not being able to learn distantly. They don't have a device, or they don't have the internet to use it on. That would be something that we can do as a state. We can provide broadband internet. We're doing it right now in Grace Harbor. Like they did it, like the PUD. We live at Public Utility District all across the LD19. The PUD supplied Wi-Fi hotspots for kids to go and use their devices and do their homework and read what they needed to read. So we can do that all over the place. It doesn't have to be somebody doesn't have to make money off of it for it to happen. And that's something that's like blows people's minds if I say that. Like people don't have to make a profit for this to happen. It can be a public good. It can be something that we do for each other, and even if somebody else doesn't make money off of it, you know what I mean? I rambled on quite a long time there, but I just really think that my kids are going to be okay even if they don't go to the building, and they're going to be better off because they will be alive, and so will I, and my mother and your mother and your father and all, they'll be alive and have the opportunity to grow and change and learn something from this situation, right? They're going to learn something just from being alive right now.
Very true. Very true. There's a lot of lessons that are learned through experience, not just from books. And I think too, it's a time to challenge. Like learning. We're in the information age. Learning can happen anywhere. Information is available all the time. You were talking about asking your kid to help you with your phone. We live in an age where you can just ask Google, right? You can just say someone's name into the ether. If I say it now, it'll talk back, and then ask a question, right? And it'll give you answers. Like, and so to think that education has to be tethered to one spot, we have to challenge it. And I think we're starting to see it now with talk in colleges, because they're starting to move to online, and people are really upset about it and saying how it's going to be less than. And I just say, no, I think what you're really looking at is it's going to be better or as good. And potentially it just might undermine this huge cost that we have going. And it's, I can see why they're scared about it. If people realize, wait, I don't need them to learn, and information matters whether or not they sign a certificate, right? I'm smart,
right?
Even if I don't have their signature, right?
That's right.
How does their signature make me a better person, right? So
exactly.
I think that's where the pushback's really happening, is they're scared of us figuring out that information's free and we don't need them.
That's right. It is. It's right here. We carry the world's information right in our pocket.
Exactly. There's Harvard University. You can take Harvard. You'll watch Harvard lectures on that phone, and you don't need to pay attention.
Yeah. That's right.
So in closing, I'd like to give you an opportunity to just remind us about where you're at, what you're running for. Give us your donation info, website info, all that stuff.
All right. So I'll repeat my name. I'm Marianna Everson. I'm running for LD19 state rep down here in Southwest Washington. We call it Timber Country. I grew up in this town all through school, and I moved away for a little while, but now I'm here to stay. I've been back for 15 years or whatever. Anyway, so I'm here because I really care about this place. I love this place. I'm never leaving, and I couldn't stop loving it if I tried. I want to see everybody have a thriving life, not just a surviving life. And I think that we can do that with some really smart progressive policies. And I'm willing to fight for those. I'm willing to fight for you. Hope you'll go to my website, mariannaforthepeople.com, which is MARIANNA, the word for FORTHEPEOPLE.com. I have a donate link there. If you can afford to give us 5, 10, 20 bucks, that'd be great. We're funding this completely by the people, not corporations. So any little bit counts. You can read my policy positions, my platform, and you can get involved in our campaign. And I really love to see more donations and more people volunteering, because that's what we're doing to get this win in the books is people power.
Excellent. People power.
Yes.
Thank you for joining us, Marianna.
Thank you.
Good luck, and hopefully we'll see you in November, and you'll be winning it and taking it home for all of us.
Heck yeah, let's do this.
All right. Thank you.